Another aspect of having the conversation around trauma and substance use that's really important is helping the client identify that maybe that substance use was a survival tool. So this is really different. For many patients, they have a lot of shame and carry a lot of stigma, internalized stigma around substance use. But sometimes what I do is try to turn the perspective, and I will say to them, you experienced really traumatic childhood or a really traumatic event. And that substance, that alcohol or that heroin or whatever the case of the substance might be, may have helped them survive an awful experience. And so if someone was experiencing longitudinal abuse in a home and they drank to get through that, to survive to the next day, I want to honor that experience. And I want to honor the fact that that substance may have been the only tool that they had access to. They may have not had access to therapy or psychiatrists or a caring adult. And so that substance may have helped them survive into adulthood. We want to support them developing other tools longitudinally, but I also want to honor the fact that that substance may have helped them survive. So again, really helping to break down some of the stigma and helping them understand that the trauma might be the driving source of some of the substance use. I also want to say that not everyone who experiences trauma as a child goes on to use substances, and not everyone who uses substances has a driver of trauma for their use. So I just want to make sure that feels clear. But the research is profound around if someone had a lot of childhood trauma, they're more likely to use substances as an adult.